My name is Yakundua Omar. I'm going to be presenting about the Huntington's disease. Huntington's disease, this is a genetic disease, hereditary disease. It's passed down from the family to the offsprings, from the parent to the offsprings. It is autosomal dominant disorder. Only one copy of the gene is necessary to be expressed. Huntington's disease is a disease that's affected part of the brain called basal ganglia, as we can see in the diagram there. Basal ganglia is a part of the brain located in the cerebrum. The primary function of that part of the brain is motor control. Huntington's disease, anybody suffering from this Huntington's disease, that part of the brain will be affected, and we will see later down the slides that person will not have control over his or her movements. It is also caused by mutation of the Huntington gene. CAG nucleotide repeat in the instructions for making the protein Huntington. Major phenotypic features, what we going to see in the person suffering from this debilitating disease: uncontrolled movements, emotional problems, loss of thinking or cognitive abilities. As we have earlier mentioned, because of the part of the brain that this is affecting, that person will not have control over his or her movements, poor coordination of movement. It will have trouble walking. It will have trouble speaking. It will have trouble swallowing. If this person is in the hospital, what they normally put this kind of person is on thickened liquid in the case of swallowing. You cannot give this person ordinary water to drink, otherwise this person will choke. This person will suffer from emotional problems because he does not have control over his emotions. He will be highly aggressive. He will be depressed. He will have changes in personality. This person, highly aggressive, can hurt himself or any other person without even knowing it. Loss of thinking and cognitive abilities. He will have trouble learning new things. That concentration will not be there for him or her to sit down to learn new things. He will not comprehend it. If you try to teach this person new things, he will not get it. There will be a decline in thinking and reasoning abilities. This person will have trouble making decisions. There's a case study I would like to mention in this video about a 28-year-old female with a history of abnormal movements of hands and face, behavioral changes, no history of weakness of limbs, drug intake, or pain. As I had mentioned, there's a genetic issue. Family history revealed maternal grandmother and mother had similar abnormal movement until death. 3 out of 5 of her siblings had similar symptoms. Her 2 children, thank God, are free of symptoms for now. However, this person was on constant watch. How this other was diagnosed, how this lady was diagnosed, evaluation of history, evaluation of family history by clinical examinations and assessments. Also diagnosed through tests like CT scans and MRI. Ultimate cause of disorder, like I have mentioned, is family history. What is the prognosis? The disorder will progress, but proper treatment could alleviate the symptoms of movement disorder. How do we treat this kind of disease? As we will later see, there is no cure to this disease, but the disease can be managed, the symptoms can be managed by medications, oral medications like Haldol, to alleviate some of the psychiatric part of the disease, that the psychiatric manifestations of the disease. Etiology and pathogenesis. More common in European ancestry, affecting 3 to 7,000 people, less common in African and Asian descent. Huntington's is a protein that plays an important role in nerve cells in the brain. The gene that encodes this protein is Huntington gene. The Huntington gene contains a CAG trinucleotide repeat. If this repeat occurs too many times in the gene, it will disrupt the encoding of the gene Huntington. In normal cases, the CAG segment is repeated 10 to 35 times. The more repeats, the more likely the individual will develop Huntington's disease. As the gene is passed down to the offspring, the repeats may lengthen. The phenotype and natural history, the diagnosis, we have already mentioned, mainly diagnosed by MRI, CT scans, psychiatric evaluations to judge emotional stage patterns of behavior, quality of judgment, coping skills, signs of disordered thinking. Neurological examinations to judge motor, sensory, and psychiatric symptoms. Genetic counseling and testing, predictive genetic tests. And what are the symptoms? Like we've already mentioned, it will have movement disorders, cognitive disorders, psychiatric disorders. What also noting that this person will be OCD, will be mania, will be bipolar, operating from two different poles. One for a minute it will be a normal person, but the next minute it can flip 360 and be a total different person. Well, we already mentioned this person will have difficulty organizing and prioritizing or focusing on tasks, lack of flexibility and tendency to get stuck on thoughts, behavior, or actions. Lack of impulse control. It will do anything that he feels like he will not have any control over impulse. Lack of awareness of one's own behaviors and abilities. Slowness in processing thoughts and finding words. Difficulty in learning new information. How can we manage this behavior? Like I've already said, there is no cure for this disease, but the symptoms can be managed with medications. Movement disorders and psychiatric disorders. What are the therapies that can alleviate or help this person to function well in the society? That person may go through psychotherapy, speech therapy, because the speech will be affected. You cannot even understand what this person says. The physical therapy to help with the bones, to help with the movements. Occupational therapy to help with the basic skills of life. Inheritance risk. Affected persons usually inherit altered gene from one affected parent. If one person has the altered gene, the likelihood that their offspring will have it is dramatically increased, like we've already learned in the genetics inheritance. It is dominant autosomal. Prenatal testing. Is there any way we can test for this disease before the baby is even born? If a parent knows they carry a gene for Huntington's, option can be discussed. Alternative reproductive techniques, donor insemination or IVF. If the child has already been born, it can be difficult to determine if that mutated gene will cause the disorder later in life. Now I want to talk about the phylogenetic tree. The Homo sapiens gorilla, we have learned about the genes and how close this gorilla is to the humans. like we have learned, is about 99% closeness. Uh, we have a pen through that Huntington shame and other the four and others, but the ones that are very far from us, maybe the macaca mulata, rhesus macaque. So with this, we learned that Huntington's disease is a very debilitating disease. If you have a family member or any loved ones or person experiencing this, that person will need a lot of help to navigate his surroundings and watch his behavior, and make sure if you live in region, make sure the environment is safe, because the aggressive part of the behavior is something one has to watch very well. With this, I hope you have learned the Huntington's disease and you will be aware.